Bone marrow aspiration. In this video, you'll be going to see the needles used for bone marrow aspiration, sites for bone marrow aspiration, what is dry tap, what are the indications for bone marrow aspiration and contraindications for bone marrow aspiration, and the complications of bone marrow aspiration. Bone marrow aspiration, the needles used are Sahil's needle and Kilma needle. The sites where we perform bone marrow aspiration are sternum, anterior superior iliac spine and posterior superior iliac spine, iliac crest, spinous process of lumbar vertebra, and in infants the ideal site will be tibia, upper end of the tibia will be the ideal site. And contraindications where we are not supposed to do bone marrow aspirations are hemophilia or any hemorrhagic disorders like congenital hemorrhagic disorders. Dry tap means during aspiration where the bone marrow we won't obtain the bone marrow in the aspiration, that is known as dry tap. Dry tap where we can see the bone marrow is replaced by any other tissue like hair cell leukemia or myofibrosis. Bone marrow is replaced by the fibrous tissue. And the complications of bone marrow at the site of injection of the needle will get local infection, hemorrhage or cardiac tamponade or mediastinitis. These are the complications of bone marrow aspiration. Now we'll see the indications where we are supposed to do bone marrow aspiration. First one will be diagnostic purpose. Next, post-treatment follow-up and therapeutic. For therapeutic means after bone marrow transplant, whether the bone marrow transplant is this thing or not. Post-treatment follow-up, we give therapy, there will be response to the therapy or not, whether there is an improvement in the condition or not. To see the that like follow-up cases, we do bone marrow aspiration, that is in case of leukemia, aplastic anemia and agranulocytosis. There are granulocytes and agranulocytes. Agranulocytes increase in number, cytosis means increase in number, agranulocytosis, or aplastic anemia where there is no bone marrow, like bone marrow content will be less, more it will be filled with a fat. And leukemia, to calculate the fat number of hematopoietic stem cells left, that is 100 minus age. If the person is 80 years, then the 20% of the stem cells will the 20% of the bone marrow cells will be the hematopoietic stem cells. And in case of leukemia, we see all these cases. And miscellaneous disorders like pancytopenia means all the cells will be decreased, like erythrocytes, WBCs, platelets, all cycles. And unexplained cytopenia, these conditions you see in the miscellaneous conditions, whereas iron stores are decreased, there also you see bone marrow aspiration. In case of diagnostic, there will be primary hematolymphoid disorders like RBC disorders, WBC disorders, platelet disorders, or myeloproliferative disorders, myelodysplastic disorders. RBC disorders are nutritional anemia like megaloblastic anemia, pure red cell aplasia means RBCs are not producing. Then white cell disorders like subleukemia, sub means below leukemia, or aleukemia, there is no leukemia, or leukemia. Leukemic diagnosis or classification of acute leukemia, we do bone marrow aspiration. In megakaryocyte disorders like IPT, idiopathic thrombocytopenic purpura, or any other thrombocytopenia, we do bone marrow aspiration. Or myeloproliferative disorders like CML or idiopathic thrombocytopenia or polycythemia vera, we do bone marrow aspiration. Plasma cell neoplasms or myelodysplastic syndrome, we do bone marrow aspirations. These are the indications for bone marrow aspirations. In this video, you learned about the needles used for bone marrow aspiration, site for bone marrow aspiration, contraindications, indications, what is dry tap, and the complications of bone marrow aspiration. If you find this video helpful, please do like, share and subscribe to my channel. If you have any suggestions, let me know in the comment section. Thank you.